If someone you love has just been told it's time for hospice, you're probably overwhelmed, scared, and full of a lot of questions. I get it, but you're not alone. So we asked ChatGPT to compile the most common questions for families when it comes to hospice care. And today, I'm going to answer them honestly, simply, and from the heart. Whether you're navigating this right now or preparing for the future, this video will give you some clarity, comfort, and confidence to help you take the next step. Let's go.
Yeah.
Whew.
Let me answer your guys' questions.
Questions. Man. Okay, Tina.
Okay. Are you ready?
What we got going on?
Are you ready for the rapid
ChatGPT.
fire?
Okay.
Let's see. How do I choose a hospice provider?
Ooh, that's a great question. I think a lot of times when families are trying to find a hospice provider, it's difficult because usually it happens I would probably say 7 times out of 10 in a hospital setting because they're not really ready for it and their loved one is needing hospice and the doctor says you need hospice. And so they literally get like a deer in the headlights kind of experience. And then after that, they just literally have to sometimes go with what the social worker is saying or go with what the doctor is saying. And then they have to pick on a list. And so that's not the ideal, right, scenario. But then there's a lot of times where patients have a little bit more time because they're maybe more aware of the benefits of hospice, and families that have a little bit more time, that's more ideal. And if they're able to Google, interview them, talk to them, get to know, what their mission, what their values are, what their core values are, and really get to know the people there, and also word of mouth. If you have, a loved one or a friend who's experienced hospice and they're like, yeah, you should go with this hospice, I think that's the best bet because hospice is all the same in terms of the benefit of hospice for families, but it's just the way each hospice is run, just like Chick-fil-A and Popeyes. So, good question.
Thank you. How do I know that my family member is ready for hospice?
So, I think it all depends on your loved one's wishes when they're what they call A&O, like alert and oriented. So if your loved one has a will that's in place and things that they want to be done and not to be done, I think that's the first step. And having that conversation way before hospice is really important for families to have because then you can honor their wishes. But there's a lot of criteria when it comes to hospice care. There's just different diagnoses in the hospice world. We call it LCDs. Those areas of the LCDs are like the cardiac, right? You've got dementia, you've got Alzheimer's, you've got kidney failure, you've got COPD, all these different diagnoses. And within those diagnoses, there's criteria that has to be met in order for someone to be eligible for hospice. But when you're looking at hospice as a whole, there's a steady thread, right, that kind of paints the picture of hospice. And that's just decline, right? So if your loved one's not able to do what they used to do 6 months ago, 3 months ago, they're losing weight, they're not wanting to eat, they're not wanting to do certain things that they love to do anymore. They're saying, I'm done, I'm tired, I don't want to do this, I'm ready to go. They're constantly saying those things, then that's a really clear picture. But that kind of all has to line up with you understanding or knowing what your loved one's wishes were when they're alert and oriented, when they're able to talk and able to say certain things rationally. And hospice is hard. It's not it's not something that is easy to talk about, but it is important because it is a benefit and it's there to help families walk through that journey of end of life. So, good question.
Thank you. So how many times a week will an aide or a nurse come out? How do we decide that?
That's a good question. So we were talking about this earlier at IDT, is that hospice, everyone's getting the same amount of funds from the government to perform services. right? And so it's the job of the hospice to manage those funds well and spread those evenly between patients and staff and such. And so there's these best practice guidelines that are given nationwide to all hospices through different associations. And this all depends, right, on the diagnosis and on what's happening to the loved one. So if you're having a patient who's just admitted to hospice, the nurse may go out 1 to 2 times a week. If the disease is taking its toll and it's increasing, you're going to probably see a higher frequency to maybe do 1 time every other day or once a day. If it gets a little bit higher from the nursing standpoint and there's a need for continuous care, then continuous care will start, and then there'll be someone around the clock or a minimum of 8 hours a day at the bedside, and then a reassessment is done every day to see if that continuous care is still warranted. And then you have the aid, right? So the aid is very essential when it comes to hospice care. The aid can go anywhere between 1 time a week to 5 times a week. 7 days a week if the hospice is able to afford that, right? It just depends. And when you're thinking about an aid, that aid is going to come out just for a bath to help with the guidance of the nurse in terms of what they can and can't do because their license is underneath the nurse. And they'll go out and help with your loved one for about 45 minutes or so, just depends. And you have another part of the team, which is a chaplain who's available, a social worker who's available. They'll come maybe once a week to once a month, just depends on what the needs are for the family. And then you've got your nurse practitioner who comes out every so often to recertify to see if there's still a need for hospice care. And that's the team. So it just depends on the need. It depends on the hospice and how they manage their patients. And yeah, great question.
This one, I don't know if it's something, I'm sure you know, but
Yeah.
so obviously I know Medicare pays for hospice fully.
Mm-hmm.
How does Medicare fund that hospice? And how much will they just always cover it for as long as they need?
That is a great question. So like we had to recently discharge a patient from hospice. And so what Medicare does is a Medicare contracted hospice will receive, it's okay. It's all good, it's part of it. She dropped her phone. A Medicare contracted hospice will receive funds after they bill, right? So let's say a hospice takes care of your loved one from January 1st to January 31st, right? And they provide services for a full month. The hospice gets reimbursed at a daily rate. And that rate is per county, per state, whatever it may be. In our area, it's about $180 a day for us to take care of a hospice patient under regular routine care. So once we provide the services after 30 days, we'll bill 1 time a month at the end of the month, and then we'll get paid for those days in 15 days. Now this is recorded in 2025. They may change that, maybe longer than 15 days, but right now they usually pay us at that. And then our job is to manage that amount for all of our patients, all of our staff, and such. So, did I answer the whole question?
Yeah,
Yeah,
you
okay,
answered
cool.
it.
Oh, cool. Nice.
Yeah. So say my loved one stays on hospice for a long time, that'll be covered the entire time.
Yes. Yeah. So yes. So as long as they're on hospice, now there's some different coverages within hospice, but that deals with mostly medication, right? So when the nurse comes out and does the admission, the nurse will review covered and non-covered medications, right? Those medications are covered under the terminal diagnosis or the diagnosis for hospice, and then the hospice will basically cover those meds. And if there's any meds that are not on that list, then your insurance will usually pick that up and you'll still pay a normal out-of-pocket amount for those medications. When it comes to anything else, you're talking about supplies, the hospice then usually contracts with a supplier and they'll give you these supplies. Now, if you want some high-end supplies, like really nice supplies, you're probably gonna have to pay out of your pocket for that. Like, this is the government giving money. If you want a really nice, sweet hospital bed, if you want a really nice, amazing wheelchair walker, that's gonna have to be out of your pocket. This is funds that are coming from, the government. So those are things that may not be covered, but they're items that are covered. And if you want the higher, like if you want a Toyota or you want a Mercedes, it's based off of your preference. So we see families buy extra stuff because they just want it. It's perfectly fine. But you can't squeeze more than what is given from the government.
So I'm not able to be at home with my mom and take care of her. Does hospice cover someone who can take care of her for more than a couple hours a day?
Ooh, man, Tina, you got some good questions. So no, I would say no, because when it comes to hospice care, hospice is specifically clinical, right? And so when it comes to the clinical needs of someone, there's these levels that have to be met. And so let's say, you're at home and your nurse is gonna come out, like we talked about, 1 time or 2 times a week. Then the aide is gonna come out 3 times to 5 times a week. There's still 16 to 20 hours within that time frame that's gonna be needed to watch your loved one. And usually families have that ability. Maybe they have loved ones to come and help, or they pay for someone out of pocket to help cover those hours. Now, the only time that you're gonna have someone coming out 24/7 is at the end, or when there's instability for your loved one. What that means is there's increased pain, they need medications, they're anxious, there's a lot of need. Then the hospice will basically, reach out to their medical director, reach out to them and say, hey, we need these certain things, and then they'll have to go through those levels and get approval for someone to be at the bedside. But normally, hospice is not that. It is there to support families clinically, but there's that gap. So that's a great question, because I feel like that's probably the most. People ask that so much,
Yeah.
And I wish that it could happen. I do wish that was the case, but that's not. It's not financially possible for the government to do that, So, yeah, good question.
Thanks.
So that approval process you were just talking about,
Yeah.
how long does that take? Say my loved one is
Yeah.
declining really fast.
Yeah.
How fast can I get someone there?
Yeah. So the way it works on the back end side for hospice, the way it works is that there's these clinical criteria that has to be met in terms of, they need more help. The family can't maintain the care at home by themselves, and it's warranted. So, medications every so often around the clock, or there needs to be someone that they're not safe at home, so someone needs to be there consistently. If that's the case, then that hospice, depending on how the hospice manages their team, they will send a nurse out, do an assessment, and then coordinate with the doctor, say we need to start continuous care. And then literally they'll either staff it themselves, or they'll use a contract staffing company to have a nurse that's partnered with that hospice to sit at the bedside, to be there continually, it has to be a minimum of 8 hours a day. And then the next day, the nurse will then come out again, the RN will reassess to see if there's a continual need for that to continue the next day. So, so it can start pretty quickly.
How do I know if I should make that call? Is it just better to be safe than sorry?
Yeah, I think it's the communication with the family and the nurse, right? When you have that nurse, you have that trust, and you have that relationship, the nurse will be able to help, right? So calling that nurse, having that relationship, the trust factors for the nurse to say, yeah, I think it's time that we need to do continuous care. Or the nurse will say, no, I think this is what you need to do to manage it, and instruct them to do these certain things from this time frame to this time frame, and then call back and check in, right? So you still have the access to that nurse to be able to help, but it just may not be someone at the bedside. But that's kind of, I would say, always ask.
Got it. I'm not the biggest fan of my nurse for my mother.
Yeah.
I don't think she's listening to our needs.
Whew.
Same with the facility, they're not doing very well. I don't like the way my mother's being treated. How easy is it? Like, what would your advice be?
Man, so
forward.
I would say, I think there's always other nurses because it may be a personality. So some personalities just don't mesh. You can ask the company if there's another nurse. You always want to see if you can talk to the director of nursing or the administrator and say, hey, this is what's happening. Is this normal? Like, can we get another nurse? Or this is something we can do. What can we do? And you can always do that. If you do that, give them the benefit of the doubt. Sometimes people get caught on, we're all human. So I think that's the best thing to do. And then if you've tried that and it still's not working after then you can, at any time, you could transfer to a different hospice. You can change. You can go to a different hospice. It's your right. It's your benefit. So, I think give the benefit of the doubt, but then at the same time, switch.
Thank you.
Yeah.
I will be trying that.
Awesome.
So thanks for taking time to watch this video. Please like and subscribe. If you're in the Dallas-Fort Worth Metroplex and looking for home health, hospice care, personal care, veteran care, please don't hesitate to give our office a call at 972-778-8038. God bless and see you next time.